is Jessica Gorbetz, and this is my informative speech. Have you ever wondered what goes on during someone's brain surgery? Well, I'm here to tell you all the little details about it. You will know what occurs from start to finish from the brain surgery. I'm sure some of you had a family member or even just someone in a movie that you've seen had brain surgery. Raise your hand if you ever know someone whose life may have been affected by having or needing brain surgery. I have. Watching Grey's Anatomy, I have seen hundreds of patients get brain surgery. Every time I see it, I've always wanted to know more. After listening to my speech, you will be a brain surgeon expert. Being a brain surgeon expert could potentially one day lead you to your profession in the future. First, I will explain the most important step of brain surgery. Pre-op, which is what you need to do before the operation with the patient. You will need to know who your patient is and which tests to run prior to the operation. First, you meet with your patient and introduce yourself as their doctor. Next, you look at their chart and you check to see if they need any tests such as blood tests or any x-rays. The pre-op period is usually about 2 hours before the surgery. I would recommend looking into the website www.teachmesurgery.com for further information about what goes on in the pre-operation time period. Once the pre-op assessment is completed with your patient, you then move on to the actual surgery happening. Secondly, you lie the patient down on the table and give them general anesthesia so they don't feel anything. After that, you make a very small incision in the head right behind the hairline. Then you open the skull by lifting the skin and muscles and creating burr holes in the skull with a drill. Next, the dura is opened to expose this brain matter. Dura is a thin layer in which covers and protects the brain. Sometimes retractors are used to hold the dura away from the brain to make the surgery much easier. To follow, the surgeon corrects the problem. Surgeons use many different little instruments to help during the surgery, such as long-handled scissors, dissectors, and drills, and lasers. To finish up the surgery, the brain is closed. After the problem has been fixed, all retractors have been removed, and the dura is then put back on with sutures. The muscles and skin are sutured back together, and a soft adhesive dressing is placed over the incision. Usually, that whole process took about 3 to 5 hours, or sometimes even longer, depending on what certain type of brain surgery a patient needs. The website, www.mayfieldclinic.com, has all the information and goes in depth step by step through the whole procedure. You know exactly what happens during a brain surgery, but do you know what takes place afterwards? Getting to know this now will be much easier to remember everything about brain surgery. Lastly, the surgery is finished and the patient is brought to the recovery room. The recovery room is known as the Neuroscience Critical Care Unit, NCCU for short. Once in the recovery room, the nurses and doctor run a variety of tests to check heart rate and make sure vitals are good. The patient is allowed to see their family and friends after the nurses have done all the proper assessments to make sure the patient is stable. The process takes about an hour to finish all the tests that are needed. After the Neuroscience Critical Care Unit, the patient will then contribute to recovery in one of the hospital's neurosurgery nursing units. Depending on how invasive the surgery was, the patient will stay at the hospital for about 2 to 5 days. Lastly, being released from the hospital, they will be provided detailed instructions about home care and what they need to do to recover correctly. You can find all the information and things needed to know about what happens after brain surgery at the website www.hopkinsmedicine.org. Now that I have explained all the important information about brain surgery, let's all review what we covered in this speech. Today, I shared with you the most the three most important steps in a brain surgery and everything that goes along with it. The first step was pre-operation, where you got prepared and ready for the procedure. The second step was the actual surgery itself, where I talked about exactly what goes down during it. Lastly, the third and final step was the recovery stage, which is settling in the recovery room after the surgery, then officially going home. These valuable handouts are your tools. Take them home and study them. By reading them, you will remember all the information we talked about today and become a brain surgery expert. Thank you so much for listening to my informative speech this afternoon.